Hi, it's Dr. Diane Hayden, publisher of Natural Nutmeg magazine, and I have with me here today Dr. Katy Firisin, who's a naturopathic physician. She owns Coastal Naturopathic Medicine in Fairfield, and we're excited to be talking to her today. We're going to be talking about her background, how she got started, and her passion in natural medicine, and a little bit about her practice. You can learn more about her. So thanks, Katy, for being here with us today. How are you?
Hey, Diane, thank you for having me. I'm
Awesome.
excited to be here.
Cool, great. So, one of the first things I love to ask practitioners is, how did you get started? I mean, what was it that kind of led you to go down this path of studying to be a naturopathic physician and, get involved in natural medicine? Was there something specific, or have you always, sort of had a passion for it, or kind of what was the impetus for that?
Um, I've been in healthcare for a long time. So I started out as a physical therapist, and I had been a physical therapist for about 10 years. And when working with patients, just really saw that there was a need for patients to be treated on a deeper level. So most patients, even with physical therapy, are still, it's kind of a one-dimensional treatment, still taking medication, still kind of in that medical model. And when I lived out in San Diego, I had the opportunity to be given the role of program director for an alternative pain program. So we were doing Watsu, which is a water massage, cardiorespiratory biofeedback, yoga, really introducing other ways of treating pain. And that got me interested in other alternative treatments for patients. And then with my own personal health journey, struggling with thyroid and PCOS and weight gain and Lyme disease, all in my high school years and into my 20s, really started looking for alternatives. My mom actually found a naturopath in Connecticut, and I went and saw him for a while. And it really helped me quite a bit. And I've been able to, I was able to kind of undo my own PCOS. I don't have that anymore. I'm off thyroid medication. And that just really helped me to see that there was more that I wanted to do for patients. So I just quit my job and went out to Arizona and went back to school. So
That's exciting.
here I am.
Awesome. Yeah.
Yeah.
Yeah. I find that that is often the common answer, that people were either struggling with some type of a health issue or emotional issue. And, obviously you also are the type of person that wants to help other people. That's why anybody goes into medicine, really, or some type of healing modality. And so that's kind of what led them down the path. Many naturopaths will say, I was struggling with a food allergy or some type of issue, and I went to all these traditional doctors, couldn't figure it out, and finally
Hmm.
found natural medicine and decided that I not only was it helping me, but I wanted to be able to expose more people to that and help more people through
Right.
what we call, or I should say what many people call alternative medicine, but really, like, to me, this is traditional medicine. Western
Yes.
medicine should be called alternative medicine.
Yes. I have a patient who calls me he calls me the real doctor. He
Yeah,
calls his other doctors. They're not my real doctor.
that is too funny. True,
Yeah,
but
he's fun.
and funny. Um, so let's talk about that, because I think that us, especially me, being publisher of a magazine, doing this for so long, I feel like everybody knows about what natural medicine is or what naturopathy is, and it's still I'm finding still that there are a lot of people that don't really understand what it is you do, or maybe what is the difference between what you do and maybe what a nutritionist does, or a functional medicine or integrative medicine doctor does. So let's talk a little bit about that, like from your perspective. What
Right.
kind of a doctor are you? How do you treat? How is it different from some of those other types of practitioners?
I think some of the confusion comes from the variation in scope of practice by state for naturopathic doctors. Um, for example, I went to school in Arizona and we have a very broad scope. So we are able to prescribe medications there, perform minor surgeries. But in the state of Connecticut, I'm not able to do those things. So people don't necessarily understand that I actually went to a full 4 years of medical school and am trained in the diagnostics, the pharmacology, very similar curriculum to conventional medical school. Where we differ is the philosophy. So even different from a conventional doctor who then has gone back to learn functional medicine, or perhaps a holistic health coach. Naturopathic medicine is rooted in philosophy based on stimulating what we call the vis, or the vital force, and it's the body's inherent ability to heal itself. So really trusting that body has the ability to do that. And then my job is to give the body the tools to help that along. A lot of what we do in conventional medicine is fighting against that force, and you have to acknowledge that that force exists, just like gravity exists, just like the leaves fall off the trees and then they bloom again in spring. The human body functions in a certain way, and you embrace that and you're trying to stimulate that. And so there's really elements to that, and making sure that we're using multiple tools to do that. So you might find a doctor that only uses supplements or only uses a certain type of manipulation or IV, but real naturopathic medicine is based on using what our founders call the 6 horses, meaning you can't pull a wagon if you're not using all 6 horses. So we're trained in botanical medicine and homeopathy and manipulation, and I actually also do acupuncture and Chinese medicine. We do hydrotherapy, but the idea is that you're using all of those tools to treat the patient. So we have a lot of tricks in our bag, and in treating the cause and stimulating the body to heal is really what we're trying to do.
Yeah, yeah, that's great explanation. I think makes it more clear for a lot of people. I love that.
And one other thing I want to, sorry, Diane, one other thing just to add to that is another principle of naturopathic medicine is using the least amount of resistance with the greatest impact. And so when I see patients who go to other practitioners and they come in and they've been given like 10 or 20 different supplements, you're not trying to just give a supplement for each symptom the way you would give a conventional medication for each symptom. You're not trying to use supplements to suppress a symptom. You're trying to actually find what that least common denominator is and treat that. And so my patients in general, I'm trying to get them on as few things as possible and have the biggest impact.
Right.
Sorry, go ahead.
No. I'm glad that you pointed that out, because what I was going to say was how traditional medicine really is just putting a Band-Aid on a symptom. And it sounds like what you were just saying is that sometimes even some, natural medicine providers are, it sounds like doing the same thing, like, coming from that same perspective of, well, you have this and you have this and you have this, is, you might have a million different issues. I'm going to give you 50 million supplements. They're going to treat each one, when really that's still not getting underneath to what the root cause is of all of these symptoms, and figuring out how you treat that. So, yeah, I think that people need to, realize that the body has this innate knowledge and this amazing ability to heal itself. And a lot of us are still caught up in, oh, I have this disease, or I have this issue, I need to go to a traditional doc. I need to get a drug, or, I need something to fix it immediately. We're still in this sort of, instant gratification type of society. And you need to realize that, you didn't get to that condition overnight. So you shouldn't expect that just because you can go get a drug that it's going to fix it overnight. Or even if you go to, a naturopath or a natural medicine provider, it's going to take time to kind of unravel what's going on and figure out, how did that even start? What is the root cause?
And you do need to understand that if you're going to seek care with a naturopathic doctor, it is a commitment. It is definitely something you have to invest some time and effort into. And I still do have patients that come and they want me to give them that sort of magic bullet the first day. And it just doesn't work that way. And, and I try to be honest and upfront with people, but the body takes time to heal. And again, with the naturopathic medicine approach, you have to eliminate obstacles to cure. And those could be stress, those could be environmental toxins, they could be diet, food-related issues, there could be trauma from the past that isn't being addressed. And so if you're not addressing those obstacles to cure, and then also finding ways to help the body eliminate those issues, and then giving the body what it needs to actually cure, you're not going to be able to follow that progression. And so the time, sometimes it takes a longer period of time because you have to address all those pieces, and unraveling that is what I love about my job. I feel like each patient is their own puzzle, and it's kind of being a detective and really figuring out where those layers are. And sometimes you uncover one layer and then there's a whole new thing that needs to be addressed. And that again is part of the process, but it does take some time.
Yeah. But you know what I say to people that are, that might be, I guess, afraid of the commitment, or like, oh God, this is going to take so long. Well, okay, but do you want to be on a drug for the rest of your life? Do you want to continue to
Right.
have more symptoms, or more issues from being on multiple
Mm-hmm.
meds for the rest of your life? Like, how long is that going to take?
Right. Right.
There's no end in sight to that, really. So,
Right.
what
But
I mean?
it is easy sometimes for you or I who are in this environment or talk to these types of practitioners and patients all the time. It's easy to say to somebody like, well, do you want to be on that drug for the rest of your life? But there's a fear that people are raised with, a fear that if we don't take this medication, that something bad's going to happen, or that my doctor is going to get mad at me, or that I don't necessarily have that control, that you're looking to that external source for that crutch. And you have to really teach people and work with them and help them shift their paradigm and their belief system, because you can't just go in and be like, well, do you want to be on that drug for the rest of your life? And, be kind of tough love. Some patients I can be that way with, but, I feel like my role is really trying to meet patients where they are. And if it means baby steps, if it means keeping your medications the same for 3 months while we work on gut and healing and diet and lifestyle and all those other things, and then you're ready to take that baby step and talk to your doctor about backing off your medication, then that's okay too. You have to really approach people where they are and bring them into the belief system, because it's almost like, and I hate to use the example, but it's almost like trying to convert people to a different religion.
Yeah.
You really have to approach people that they don't believe what I believe in many ways. And sometimes people like the idea of natural medicine, but that's not really adopting a different belief system. And so that's where I feel like my role is working up with patients to get to the point where they can trust their own bodies. And
Yeah.
that's a hard leap to make for some people.
Yeah, yeah. And that's why you're the naturopathic physician and I'm the publisher, because I don't have the patience for that. And I just want to tell people, this is what you need to do and you need to do it now and stop complaining.
Yes.
But what you just said
Yes.
actually leads into another question that I had. We were talking about this earlier, and you're actually writing an article about this, is the whole belief system. And, you are very passionate about helping people, move beyond a belief system that they might have about some diagnosis that they've been given. So do you want to talk a little bit about that and what your article is going to be about?
Sure. One of my mentors, he's another naturopath named Dr. James Sensenig, brilliant, brilliant man. He talks about the idea of paradigms. And paradigms is just basically the world you live in, the belief system that you have. And when you have lived in two paradigms, it's easy to understand the difference. But when you've only lived in one paradigm, it's hard to really, you don't know the other one. You really have to learn that and kind of break down that belief system so you can be open to something else. And so for me, because I was raised in conventional medicine and then also trained in conventional medicine as a physical therapist and being part of that world, it's easier for me to understand where patients are coming from because I know both worlds. But for patients out there to really say, okay, wait, that's really challenging my belief system, and that in and of itself is an obstacle to cure. So if you don't believe that you can get better, if you don't believe that you can not have diabetes anymore, or if lots of people think that once you're taking thyroid medication, you can never get off thyroid medication ever, and that it's dangerous to stop. Yes, you have to pay attention to what the process is to get off that medication. You can't just stop things cold turkey, but really trusting and believing and changing that mindset and that dialogue is really important. But I think we also latch onto our diagnoses too. We say, oh, I am diabetic, or I am this, or I have, I had a heart attack, so I have heart disease. And people get scared and they attach to that, but then that also gives them a weakness, that kind of is an Achilles heel for that person, because then they also believe that their body's dysfunctional in some way. In actuality, our symptoms are a manifestation of our bodies functioning properly. It's a compensation for something that's awry that needs to be corrected. And so your body will always manifest something as a compensation for something else. And so a fever is started because your body's trying to create an inhospitable environment for the bacteria. And, we end up laying down plaques in our arteries because our body has inflammation, and we're actually going to that inflammation in the artery trying to repair it. And that's what that plaque is. So your body is always trying to do something to correct the situation. And if we help it do that, then we can actually get better. But if people don't believe that, then that's where you have to start, is really trying to shift that belief system and that language that we use, and not identifying with that diagnosis as a label. I listened to a TED Talk that was really interesting. It talked about the idea that categories and disease names and things like that were really established more for like scientific pharmaceutical research. So you can have sort of a control group and a non-control group, or the disease group and the non-disease group. And those are not really measures of anything human or anthropological or anything really about each individual person. So people get stuck in these categories, and that happens with insurance. I mean, how many people can't get reimbursed by their insurance if they don't have that diagnosis code? And then only certain diagnosis codes get reimbursed. You have to qualify for the insurance coverage because you have to have a diagnosis. And so that's not fair to people. They get really stuck with that mentality. And then here I am trying to ask them to break out of that. And you can imagine the conflict and the fear that people experience with that.
Yeah,
so it's
totally.
tough. It's really a hard situation.
It is. And it's just amazing to really think about the impact of words and the things that we say to ourselves, but also, like, many people look at a doctor as, I don't really want to say God, but I think some people do sort of have that, image of guys, women in the white coat, and it's like, oh, whatever the doctor tells me, oh my God, like that's my label for life or for whatever, because somebody with an MD after their name, gave them that label. And it's just, the belief system is so important. And I think a lot of people don't really think about that or even realize what is that energetic impact on the body.
Right. I totally understand. And that mentality, the sort of white coat mentality, is a relatively recent thing. Doctors, and I'm a big Little House fan, but I wanted to be Doc Baker and have my patients pay me in chickens and be part of the community and be part of and one of everyone else, and not that I'm up here and everybody else is down here. And I don't want to offend any MDs out there, because I think there's other aspects to the culture that have facilitated that mindset, not the doctors themselves necessarily in some cases, but I think patients do think that there's kind of this authority there. And for me, my relationship with my patients, it's a balance, it's a partnership, it's a community, and you have to work with that patient and listen to them. Being a naturopath, I get to spend more time with patients and I get to listen to them, and I think that makes a big difference too. When you don't have the time to spend with patients, you have to just base your decisions on a formula and just plug things in, and then that's where you end up. So it is really challenging. And then I think patients don't feel empowered in that system. They're looking to someone else for an answer or a solution, when their solutions very often are inside. If they just trust themselves and listen to their bodies, you can get a lot of information and glean a lot of value from paying attention to yourself and listening to yourself too.
Yeah, I totally agree with that. And I think what you alluded to before is we tend to put doctors on a pedestal. And so that's the responsibility of us too, as a patient, to not do that, and to, value our innate knowledge and our ability to heal just as much as, someone who's been to medical school, who may have more knowledge about disease process and that kind of thing. But in the end, it's all about what we do to help our own body heal.
Right. And I have the knowledge and the experience to guide someone in that process. So I'm certainly not encouraging people to go try to heal themselves or fix it all. I mean, I have to say, Dr. Google does not, it doesn't work in most cases. But I do want people to understand that they have a say in what's happening, and it's okay to question that and say, you know what, when I take that medication, it doesn't make me feel right, or I don't want to do that. What are my other options? And as providers, I think we should be responsible and know what those other options are. And I think we are progressing as a medical field in general in healthcare. I think it's much more common now that a patient will go to their doctor and say, oh, my naturopath has me taking X, Y, and Z. And the doctor's response is, oh, that's great. If it's working, good. 5 years ago, the response was, oh, don't do that. That's dangerous. Those herbs are bad. Don't, I had that experience. I was working with a doctor, and I will not say specifics, but it was a local, very large healthcare organization in Connecticut. And I was working with someone for my PCOS, and they were just giving me birth control pills. And I had seen the naturopath, and I went to this doctor and I said, I really want to take these herbs. And the response of that doctor, and this was more than 10 years ago, but the response of that doctor was, if you take those herbs, you can no longer be my patient. So instead of saying, wow, what are those herbs? Maybe that's something I should learn about, and maybe that's something I should understand. It was just a closed door, done, you can't be my patient anymore. So where did that leave me as a patient?
Yeah.
I was like, okay, well, my options are to not listen to this doctor who works at this big, fancy, renowned healthcare organization that's supposed to know what they're talking about, or go this way and try the herbs. And fortunately for me, I took the leap and I took the herbs, but that was a really scary decision. And I think that now things are moving in a better direction of understanding. So I think, on both sides, people need to be open to discussion and learning new things.
Yeah, totally. Definitely. I mean, it's all about education, right? And I think on everybody's part, not just the patients, but also conventional medicine doctors really need to, I know they don't have a lot of time to spend with their patients, and I know a lot of times they're just relying on pharmaceutical reps or what they read in medical journals, but I think the time has come where more of them are going to, their patients are going to demand it. More of them are going to have to, whether or not they study it themselves, at least be open to working, in conjunction with a natural medicine provider to help treat, so that they both help treat the patient for sure.
Right.
So that kind of brings me to, you're on the board of directors, I believe, for a pretty cool organization called the Naturopathic Medicine Institute. So do you want to tell us a little bit about that?
I'm on the advisory board, so not the board of directors, but the advisory board for an organization, the Naturopathic Medicine Institute, and it's a institute that envisions a world. I'm going to read you the mission statement so I get it right. It envisions a world where enjoying optimal health allows people to reach their highest potential for inspired creativity. It asserts that the highest ideal in healthcare must act in concert with the healing power of nature. And the neat thing about this organization is the collaboration of naturopathic doctors, and we are trying to bring education to doctors, to the public, really preserving naturopathic foundation principles, knowledge that is going to be or will be lost with doctors that have been practicing for 40 years and have ties and direct connections to medicine and practitioners that practiced over 100 years ago. And really bridging that gap with young doctors and newer doctors and the public, and helping the public access that information, access physicians that can help them, that want that experience, that want to be seen by a physician that practices the way that I do. There are naturopaths out there and other natural doctors that practice, but they don't practice with those core principles in mind because they've chosen to specialize, and that's fine. But there needs to be a way to help us kind of differentiate where those doctors are. And this organization is really, the goal is to bring that to the public. And you and I were talking earlier about how treating patients and my role as a doctor and bringing people to healing is not just about helping them physically feel better. It's helping people function at their highest potential. And when we are feeling well, when we're not tired, when we're not in pain, when our bowels are moving normally, that's when we're the most creative. That's when we can function and perform the best. So if everybody in the world was functioning at their best from an optimal health perspective, imagine how much more creative and more impactful we could be in our day-to-day across the world. And that's really the big connection of this organization, that what we do in the organization is always looking at that bigger vision. And it almost like I'm ready to like getting choked up, because the people I work with in that organization are so passionate about bringing hope to people and so empowered by the idea that we can impact humanity and as doctors. And that, instead of this idea of like, you know, being up here as a physician, it's really just, like I said, being part of the community. And that's really what the organization's about. There's a website, naturopathicmedicineInstitute.org, and people can go there and look and see what we do, and information that's there for them.
Yeah, that's amazing.
That's
Amazing.
what I love about that organization.
Yeah, something we definitely need for sure, for sure. So I know that you treat a wide range of health conditions, and you know, you have numerous modalities that you utilize in your practice. Is there anything that you have, you know, like an affinity for, or that you have, you know, more of a passion for working with, or like a particular type of client that you tend to attract?
I am really passionate about, I mean, pretty much treating anyone. I'll always help anyone who needs my help that I feel like I can help. But I do end up treating a lot of gastrointestinal concerns. A lot of people who have irritable bowel or reflux or chronic diarrhea, constipation, issues like that, when those patients come in, are always tied to other health concerns. So usually that primary issue is the root of a lot of other things. So most of my patients go through food intolerance evaluations, gut healing, and how that impacts the inflammation in the rest of the system. The other thing I find I treat a lot of, and it's not necessarily the patient's primary concern when they come in, is anxiety and depression. And, you know, just a reminder to whoever's out there watching this that anxiety and depression are a manifestation of things just like any other symptom that we have in our body. So those symptoms and those feelings can be related to cortisol. They can be related to gut health. Lifestyle obviously plays a role, but I think people don't think of that as something to come to see a naturopath for all the time, because they're, you know, thinking they need to be on medications for that, or they need to go to a psychiatrist. And patients will come in for high blood pressure or for irritable bowel syndrome and end up realizing that they have anxiety. And through treating the root cause and finding those least common denominators, the anxiety can definitely be improved. So I don't treat that or think of that as a specialty, but I find that we live in a world right now where everybody is anxious. Everybody's really overstressed and frazzled and just can't handle what they're trying to do. And so through healing people, again, working towards that optimal creativity, that optimal health, that highest potential, it ends up being part of what I do. But I treat a lot of autoimmune conditions. I do musculoskeletal. I have a physical therapy background, so I do see patients who have pain, and I do acupuncture. So I see a whole gamut of things. And then I have patients who use me as primary care when they have a cold or flu and they don't want to treat that with antibiotics. You know, they'll come in and see me. So it's always good to just establish care with me as a well visit. And then if you have a cold or a gut issue or a stomach bug, you can come in and we can work with that. So.
Yeah, actually, you've written a couple of great articles about that. If people go to naturalnutmeg.com and search, I want to say it was either our November, December issue or January issue, but they can just search by your name essentially. But you had like a top 10 list for treating like the common cold, or, you know, common illnesses in the winter and that kind of thing. And then just recently in July, you have a great article on summer travel tips, which is really cool too. So it's like, you know, when certainly it's great that you have some things that you specialize in, but I think it's also good for people to know that they can come just see you as a general practitioner and utilize you that way for something, you know, as simple as the common cold, for sure.
Right. the reason that those I like writing articles like that is because I will tell you as a physician when I'm trying to treat something acute, and acute means an immediate problem, like the person has the fever right now and it's midnight on a Saturday and they can't go anywhere to get anything. So even if they call me, there are certain things that they need to have in the house. So I can say, take this or take that. So I think a lot of people can benefit from building up that sort of naturopathic toolkit. And if they reference those articles, there's ideas for things to have at home. And that actually is kind of selfishly motivated because then I can tell them to take
Exactly.
something. Otherwise, there's nowhere to go on a Sunday, after 8 o'clock if you need something. So
That is a great point for sure. So, how do you want people to be able to get in touch with you? I'm sure you want to give us your website and any other way that people can contact you.
sure. My website is www.coastalnaturalmedicine.com. I know that's a mouthful, but my practice name is Coastal Natural Medicine, so it's just what the practice name is. And my office number is 475-999-2032. Honestly, the best thing to do, I would say, is to call the office and schedule a 15-minute phone consult with me because I do offer that complimentary so that we can get to know each other. You can ask me questions, see if it's a good fit for you. But I do a lot of that, and it really helps people quite a bit. And most people will end up scheduling an appointment, but I think there's a trepidation sometimes for people to take that leap. They don't want to just call and schedule because that's,
Sure.
they're committed. So if you want to make that call and do the 15-minute consult, it's a great idea.
Okay, awesome. And you have been a fantastic writer for us, contributor for Natural Nutmeg. I'd love to know or just hear a little bit about what it's been like for you to be part of that community, to be, to write articles and to advertise with us.
Right. Well, I think just as I might be considered somebody that would help you understand the world of naturopathic medicine, you have been a great resource for me in terms of learning about the world of marketing. And for me, I've always wanted, as I said, to be part of a community and be a resource for people. So Natural Nutmeg, it's not the kind of thing where people read my articles and don't be upset about this, but I don't get calls that are from people that are like, oh, I saw your article in Natural Nutmeg. But I do get feedback from people I know or even existing patients that see my articles. And I think for them, they get excited to see their doctor in the magazine. So I think it gives them some confidence in what I do and who I am because they're like, oh, look, that's my doctor. And then it's exciting. And also just gives information to the community. So I love writing. I'm really passionate about writing, about education. So if I can do that or provide anything to the community in that way, that makes me happy. So I like the magazine. It's very professional. I think it's really well done. I feel proud to be in it versus some other publications that I've both been in and seen over the years. So I really appreciate that about it as well. As you can tell, you're part of something that's at a higher quality. So
Yeah, that's awesome.
does that
That's what
answer the question?
that
Okay.
yes, that is what what our mission is and what we have aimed to do for sure is to, have this as an educational platform where, people like yourself can educate the community and then the readers can connect with you and that kind of thing. And just, elevate it, like you said, have it be, more professional like a medical journal. And I'm sure,
Hmm.
I think many people, do feel that way just because of the length of the articles and the, the in-depth content
Right.
that we get into for sure. So, but this has been
Right.
awesome. Thank you so much. Great information
Thank
that
you.
you gave us today. And I'm sure people will connect with you either online or by phone. And hope everybody enjoyed this talk. And we will see you guys all soon. Thanks so much.
Thank you, Diane. Take care.
You too.